Medicine name: Udiliv 300 tablet. Salt composition: Ursodeoxycholic acid 300 mg. Manufactured company: Abbott. Price: 839 rupees and 96 paise for one strip of 15 tablets. Therapeutic class: Cholagogues, Cholelitholytics and Hepatic protectors. Description: Udiliv 300 tablet is used to dissolve certain gallstones and prevent them from forming. It is also used to treat a type of liver disease called primary biliary cirrhosis. It helps break down the cholesterol that has converted into stones in your gallbladder, thereby dissolving the stones. Dose: Udiliv 300 tablets should be swallowed whole after a meal and with a glass of milk or water. The dose will depend on what you are being treated for and your body weight. Take it regularly to get maximum benefit and keep taking it for as long as prescribed, several months or longer. Keep taking it even if your symptoms disappear. Usage: treatment of primary biliary cirrhosis, treatment of gallbladder stones. Benefits: in treatment of primary biliary cirrhosis, primary biliary cholangitis is a type of liver disease that gradually gets worse over time. It does not always have symptoms, but, over time, it can lead to liver failure. Udiliv 300 tablet is used to treat this condition and may be used by itself or with other medicines. It can help prevent or delay liver damage in most people, especially if you start taking it in the early stages. Once you start this treatment, you will likely be taking it for the rest of your life. To make the medicine more effective and for general health benefits, you can help yourself by stopping smoking, keeping a healthy weight, and not drinking too much alcohol. In treatment of gallbladder stones, Udiliv 300 tablet is a medicine that helps decreases the amount of cholesterol produced by your liver. It helps to break down cholesterol that has formed into stones in the gallbladder. It may take several months to completely dissolve the stone, so you need to take the medicine regularly and as long as the doctor has prescribed it for it to be effective. There might be other medicines and certain lifestyle changes that can reduce your cholesterol level and make gallstones less likely. Consult with your doctor. Side effects: abdominal pain, diarrhea, hair loss, itching, nausea, rash. How to use: take this medicine in the dose and duration as advised by your doctor. Swallow it as a whole. Do not chew, crush or break it. Udiliv 300 tablet is to be taken with food. How it works: Udiliv 300 tablet is a hepatoprotective medication. It works by reducing the amount of cholesterol in the blood and helps dissolve gallbladder stones that are composed mainly of cholesterol. It also improves liver enzymes, protects liver cells from injury caused due to toxic bile acids, and improves liver function. What if you forget to take medicine? If you miss a dose of Udiliv 300 tablet, skip it and continue with your normal schedule. Do not double the dose. Substitutes: cheaper and costlies. Also called 300 mg tab. By Sun Pharma. MRP 575 for 15 tablets. Ursodeoxycholic 300 tablet. By Alchem Laboratories. MRP 370 for 10 tablets. Ursomax 300 tablet. By Zuventus Healthcare. MRP 358.2 for 10 tablets.